So good day ma'am, I'm Glazelle Mae Vergara po from BSN 1A Group 2. So today po I'm going to perform my return demonstration of the assessment of the nose, mouth, throat, and sinuses. So the purpose of this examination is to detect abnormalities in the lips, gums, teeth, mucosa, tonsils, and uvula, and allows for early detections of oral care. It also helps identify deviated septum, nasal obstructions, and sinus infections. Furthermore, it provides clue to the client's nutritional and respiratory status and guides necessary diet changes and oral care. And also, it determines the proper nostrils or for procedures like NGT insertion or suctioning. For the equipment, we will be using a gloves, a 4x4 gauze pad, pen light, and a tongue depressor. For the preparation, explain the structures and functions of the mouth, throat, nose, and sinuses. Describe how to prepare the client and identify the two physical examination techniques used in this assessment. So, prior to do this procedure, I'm going to introduce myself, verify the client's identity, explain to the client what I'm going to do and why it's necessary, and how the result will be used. So, good day sir, I'm Glazelle Mae Vergara po, your student nurse for today from CSPC. So, before we start po sir, can you please state your name, age, and birthday po?
James R.M. Vergara. I'm 22 years old. March 31, 2004.
So today po sir, I'm going to be assessing your mouth, nose, throat, and sinuses po. So the purpose po of this procedure is to check the condition of your mouth, teeth, gums, throat, nose, and sinuses. So this will help us po detect any abnormalities and ensure you are healthy po. So hingi lang po ko ng permission niyo po. Is it okay lang po? I'm going to inspect and touch po.
It's okay.
So, if any point po na makaramdam po kayo ng any pain po or discomfort while we do the assessment, so let me know na lang po. So, perform lang po ako ng hand hygiene. And provide ko lang po kayo ng privacy. Closing the curtains. So, I'm going to gather the equipment, which is next is to I'm going to ask po muna. So, do you have any history po of dental problems po?
Yes.
Nose bleeds po ba?
No.
Difficulty breathing through your nose? So, okay po. So, I will now proceed po for examining po your mouth. So, I'm going first po, put on gloves. First po, I'm going to note for any distinct odor. So, can you please open your mouth, sir? So, okay. So, going to use pen light and a tongue depressor to check, to inspect and palpate the lips, vocal mucosa, gums, and tongue for color variation, moistures, lesion, and consistency. Open your mouth. Okay po. So, the lips, buccal mucosa, gums, and tongue are pinkish in color and moist also and soft in consistency and no signs of lesions. Next, I'm going to inspect the gums for hyperplasia. So, okay. Gums. Open it. So the gums are normal size, fit closely around the teeth, and show no enlargement. Next, I'm going to inspect the teeth for numbers in shape, color, and occlusion. Okay. Okay, so the teeth are complete and clean and properly aligned. So lastly, I'm going to inspect and palpate the tongue for color, texture, consistency, moisture, and size. So, can you ano pa ito? So, taas niyo po ang dami. Ano? Going to use ang gauze pad to palpate the tongue. Labas niyo po. So the tongue is pink, moist, moderate size, and no signs of lesion. So I'm going to now test the tongue movement and strength. So sir, going to move your tongue po in the side. Tapos ipupush ko po siya and dapat po i-resist niyo po yung force. Okay po? Okay po, very good po. So next po, I'm going to test for the sense of taste of the patient. Sir, can you close your eyes po? And sabihin niyo po sa akin kung ano po yung nalasahan. Open your nose. What did you taste po?
Salt.
Okay, very good. So now we're now done assessing the mouth. So we're going to proceed on the assessment of the throat. So I'm going to inspect the throat for color, consistency, torus palatinus, and uvula. So, sir, open your mouth. So, sir, can you say apo? Okay. So the throat is pink without exudate. So the uvula is in the midline and rises properly. So next, I'm going to inspect the tonsils for color and consistency. Okay. So the tonsils are also pink and smooth without exudate. So next po, I'm going to check for the nose. Going to inspect and palpate the external nose for shape, symmetry, and tenderness. Do you feel any pain po, sir? So sir, can you block your ano po? And breathe in and breathe out. Sa kabila naman. Do you feel any blockage po sa pag-ano?
Wala na.
So the nose is straight and symmetric, firm and smooth, non-tender, and air flows freely through both those nostrils. So next, I'm going to inspect the internal nose for color, swelling, exudate, bleeding ulcers, perforated septum, or polyps. So I'm going to use the pen light. Okay, So the nasal septum is intact and in the midline. So and mucosa is pink, no swelling, no signs of bleeding or polyps. So lastly, I'm going to check for sinuses. So I'm going to palpate the sinuses for tenderness. Do you feel any pain po, sir?
Nothing.
Okay. So no tenderness noted on both sinuses. So next, I'm going to percuss and transilluminate the sinuses. So do you feel any pain po?
Ano?
Okay. So upon percussion, they are no signs of fluid or infections. So okay, so now sir, we are now done po for the procedures po. So sir, thank you for your cooperation po. So going to position na po in a comfortable position po. Then I'm going to remove my gloves and perform hand hygiene. So now I'm going to summarize the findings. So sir, so upon inspection po, your oral cavity, throat, and nose po are normal with pink and also moist tissue po and no signs of lesion po. Then upon palpation naman po, no tenderness is noted po and all movements naman po are and functions are intact. Next, I'm going to document na po the findings. So, that's conclude po the procedures po. So,